So I just took my test, and I want to include just a quick breakdown of some symptoms that I felt that tipped me off. So you can have a lot of symptoms that result from having high progesterone, and that always happens like toward the end of a normal cycle in the luteal phase. So after ovulation, your progesterone goes up, and it can make you dizzy and like sick and a little crampy, and it can give you like a yellowish discharge. A lot of things that are seen in pregnancy can happen at that point. But what I noticed was that my cramps came at about the same time they usually do, so a week in advance, like some little niggling cramps that are just the beginning, and then they come and they show up and they go away, and then they come back like every day, every other day or so. Well, that happened this time, except they were a little more intense. They felt more like period is imminent cramps, and then would go away and then came back, so that made me think that I was probably pregnant. And what else? That's pretty much it. I had a few moments of dizziness, but like I said, progesterone can do that anyway. So that's really the biggest sign I had. Like I was probably 11 DPO when it started, and the cramps continued, and I'm still getting them on off and on, but no spotting. I didn't have any spotting. I do have a 27-day cycle, so I waited until I think today is actually day 29, because I wanted to give it one extra day to make sure it wasn't just coming late, because I really don't want to, I prefer not to look at a bunch of negatives. So, so I think we're now at the 3-minute mark, as you can see. The test is complete, and I'm trying to think of any other symptoms I might have had, but maybe like some kind of puffiness down there, like my vulva is a little bit, it gets kind of puffy from even really early on. That can happen. I think that's what's happening with me. And I kind of woke up early this morning. I think when I'm pregnant, I get a little bit of maybe morning insomnia where I don't know if that's the right word, but just can't sleep as late. So that may be happening. And that's it for now. I will update every now and again.